Good afternoon. I believe we're ready to go to have a conversation with the FCC. I'd like to introduce myself. My name is Mark Seeger, and this is my sign name. I represent the central region of the United States on the board for TDI. And I am an outgoing secretary on the board. So let me describe myself. I'm wearing a blue sports coat. I have gray hair. It's fairly short and spiky. I'm wearing glasses with blue rims and a dark black button-down shirt. I'm a middle-aged person. I'd like to let you know on the screen we have several video feeds on Zoom with our panelists with the FCC. We are going to try to turn off our videos while we're not speaking, but during the panel discussion, we will have our videos on and open so everyone can see the panelist. That is during the question and answer section and the discussion. And then we will turn our videos on and off to make it more accessible. I'd like to welcome you all to the Town Hall with Disability Rights Office at the FCC. So I'm excited to begin our TDI conference. Together, we recently got a welcome from our president, Jan Withers, and a wonderful opening keynote address from the chairperson, from Rosen or Schell, who addressed the FCC and current and future work on accessibility at the FCC in the areas of telecommunication, programs, and internet. Some of our distinguished guests today for this afternoon, I would like to introduce with their titles, and they can tell you about themselves and what their role is after I introduce their titles. So first, I'd like to welcome Diane Burstein, who's the Deputy Chief for Consumer and Government Affairs Bureau. Second on the panel, we have Suzy Singleton. She's the Chief Disability Rights Office, and Eliot Greenwald, the Deputy Chief of the Disability Rights Office. And fourth, Will Schell, who is the Deputy Chief also for the Disability Rights Office. Each of them will talk about their roles and their current goings-on within the FCC. Diane and I will turn off our videos. Oh, Diane and I will stay on video, interpreter error. And I will turn off my video. I'm going to turn it over to Diane. Please take it over.
Hi, thank you very much, Mark, and thank you to TDI for having me here. As Mark said, my name is Diane Burstein, and I'm Deputy Bureau Chief of the Consumer and Governmental Affairs Bureau of the Federal Communications Commission. The Consumer and Governmental Affairs Bureau develops and implements consumer policies, including those for people with disabilities, and it's one of the 7 bureaus at the Federal Communications Commission. As Deputy Bureau Chief, I help to oversee the very active Disability Rights Office, and DRO, as it's called shorthand, is comprised of many dedicated and talented individuals, and I'm very glad that we have several of them on the panel with me this afternoon. A little bit about me. I joined the FCC a little more than 2 years ago. Much of it has been remote, which has been interesting to say the least. But before I came to the FCC, I worked as an attorney in-house at a trade association for communications. And in that role, I worked closely with TDI on a number of video accessibility issues. So I'm very happy to be able to be here today to participate on this afternoon's panel. Thank you very much. Mark, I'll turn it back to you.
Thank you, Diane. And with that, I would like to ask a question. We have some new attendees this year. Please share an overview of the FCC's accessibility work and highlights currently active proceedings as an example of the work the FCC does. Do you mind turning on your video again, Diane?
Sure, I'm happy to talk about that, Mark. CGB and the Disability Rights Office cover disability issues in 3 main areas: modern communications, video programming, and emergency communications. And it undertakes a range of different stakeholder initiatives as well. We address disability rights matters, including access to advanced communication services and equipment, access to internet browsers built into mobile phones, telecommunications relay services, the National Deafblind Equipment Distribution Program, accessible video programming, and video programming apparatus, such as closed captioning on television programming and certain video programming online, audio description, and accessible user interfaces, text menus, and guides. And I know we'll talk more about some of these specific topics later on in the panel. DRO also acts as an in-house expert to assisting other bureaus within the agency. As I mentioned, CGB is just one of 7 bureaus, and there are other bureaus such as the Media Bureau, Public Safety, Enforcement Bureau, a whole range of different bureaus at the FCC that the Disability Rights Office coordinates with on important issues that come to the Commissioner's attention. We also assist consumers, industry, and others with issues relevant to disabilities. And we also oversee a federal advisory committee called the Disability Advisory Committee, the DAC, which is comprised of numerous stakeholders interested in disability matters, including TDI, with Eric Keiker representing TDI. To your question about the FCC's current work, obviously there are a number of issues that are going on. The chairwoman spoke to many of them. I was going to highlight just one, where we're currently looking into whether any updates are needed to the Commission's rules implementing the 21st Century Communications and Video Accessibility Act, the CVAA. Many of the disability-related matters that I just mentioned that the FCC regulates arose from the CVAA, which, as Acting Chairwoman Rosen just explained, was landmark legislation adopted more than 10 years ago to help quote, ensure that individuals with disabilities are able to fully utilize communication services and equipment and better access video programming, end quote. Given changes to the technology and industry practices that have taken place over the last decade plus, as well as taking into account consumer experiences with the rules as they exist today, the FCC issued a public notice several months ago inviting stakeholders to provide input on areas that are working well, where improvements might be made, and requirements that may no longer be needed to serve their intended purpose or have been overtaken by new technology. So as was mentioned, the period for filing comments on this public notice just ended earlier this month, and we're reviewing the filings that were made, including those submitted by the accessibility, advocacy, and research organizations of which TDI is a part. So we appreciate the thoughtful comments that have been filed, and we look forward to additional conversations about the concerns that have been raised. So that's just one of the issues that we're dealing with right now that obviously covers quite a bit within that one public notice. Thanks, Mark.
Thank you, Diane. So now I would like to turn it over to Suzy Singleton. She will elaborate on her role as the Chief of DRO, and will update us on current activities at the FCC. Take it away, Suzy.
Okay, yes, thank you, Mark. It really is great to be with all of you. As you know, resetting and reconnecting, given that we are now going through the pandemic, it really is so critical and important that we continue to connect with one another, even though we may have to connect in different ways. So I don't think you couldn't have phrased that better, as Mark said. As Mark said, I am Suzy Rosen Singleton, Chief of the Disability Rights Office in the Consumer and Governmental Affairs Bureau. We are focused on accessibility, as Diane already mentioned, focusing on video programming, modern communications, and advanced and emergency communications. We do work with other bureaus to ensure that we are all connected with everything, and that disability is not an afterthought. That is part of the mission of the FCC, is to ensure that accessibility is a priority for our work. So we are very excited moving forward. With that, Mark, you mentioned that you wanted me to answer what's new, or were you going to go ahead and...
Yes, I was on mute, so sorry. Okay, the interpreter was on mute, just so you know. Forgive us. So Suzy, in light of the current unprecedented pandemic, many people are forced to stay home and rely more and more on telecommunications and connectivity to thrive. What is the FCC doing? Can you respond to that?
Yes, thank you, Mark. Eliot and I will respond together because he is involved with TRS, the Telecommunications Relay Services, and today is the ADA's 30th anniversary. So the work that we're doing around TRS, thanks to Title IV of the ADA, is quite amazing. Back to Mark's question. Now that we are in the pandemic, what kind of emergency programs have been established and services and initiatives? What are we doing to try to address the challenges that everyone is facing when they cannot go to work in person, when they can't go to school, they can't go to a doctor, unless it is an emergency, of course. Now everything is tele everything. So what have we been doing? You've heard a little bit already from the chairwoman, Chairwoman Rosen. She spoke about 3 of 5, and I'm going to explain a bit more what we're doing as far as emergency initiatives. The first is the broadband initiative. We have encouraged everyone to stay connected, and so we've implemented a $3.2 billion initiative to allow people to have a discount for broadband services for their bills for eligible participants. So please know that those funds are very limited. So if you feel you may be eligible, please do look at www.fcc.gov/broadband benefit. It's all one word, broadband benefit. Second that she mentioned about was the Emergency Connectivity Fund. This is to help with $7.17 billion being distributed to schools and libraries to support students, school staff, and others, library patrons, to be connected to school through the library system, for broadband connectivity, for equipment, laptops, Wi-Fi hotspots. So please do reach out to your school library to see about that possibility of funds for disability accommodations as well. Third, she mentioned about telehealth. We have about $650 million that we've spent to help healthcare providers over time, to help them provide services to you, healthcare services, in a remote fashion so that you can be safe at home without having to expose yourself or others to going in for medical services. So we do want to remind those healthcare providers that they have ADA obligations to ensure that you have effective communication. We've also been working with HHS and DOJ to coordinate and make sure that we have the best possible accommodation services for patients. I do want to add 2 more areas that were not really mentioned so far. One is emergency notifications. We've recognized the importance of making sure that televised information is accessible. So we've been working with captioning vendors to label them as priority workers and ensure that they have that designation so they can continue to provide captioning services for televised broadcast information about emergencies and so forth. We've been working closely with consumers about any accessibility concerns to make sure that you are getting information that you need from the television stations that are broadcasting emergency information. There is a nationwide test. I just want to make sure that you're able to be alerted through your wireless phones and alerted through the television as well. Those are the 2 ways that you can keep on the lookout for emergency information. I will talk about those a bit more later. We will have a test call on August 11th at 2:20. We hope to hear from all of you, your observations about whether or not you were able to access that information. Was the crawl readable? Was the font and the color contrast, was it easy to read or not? We also have a forced message that pops up on the screen. Were you able to read that? Was it understandable? That's the kind of information we want to hear from you. Same as with WEAs, wireless emergency alerts. We hope to hear from you on those as well. We have a complaints form established for that purpose at fcc.gov/accessibility complaints form or dro@fcc.gov. To emphasize a bit more about WEAs, some of you have asked about tablets. Some people perhaps don't use mobile phones, so people have been asking if you can get WIA on tablets. The WIA process is voluntary, so your wireless carrier must opt in, and your device must be WIA capable, and you must have a phone plan. Those are 3 important things to take a look at and evaluate if you would be able to receive that message on August 11th at 2:20 Eastern Standard Time. One last thing about notifications, as far as the internet. Many of us are on the internet for streaming information and so forth. So Congress did ask the FCC to take a look at and see if it is feasible for consumers to watch on the internet. Is it technologically possible? That act requires us, the FCC, to submit a report to Congress by September 28th, 2021. And we did go ahead and release a request for comment last March. And thank you, TDI and many consumer organizations did submit comments to really highlight the importance of the internet being another tool for emergency notifications. The last area I wanted to cover before I turn it over to Eliot is emergency measures around communications. And what are we doing in that space to ensure that you are connected during the pandemic? So here, I would invite Eliot to join us to see, welcome Eliot. And I will, while you're here, please introduce yourself. I know that Mark, I don't know if Mark wanted to turn his video back on to ask you a question or not.
Hi, Eliot. I'd like to add to this question. Recently, Suzy added some information for her answer, but thirdly, accessibility via communication can be very important in emergency situations. Recently, we had a huge weather storm in Texas in February. So there were a lot of requirements for emergency accessibility and to be in touch with the emergency systems. So I'm curious, how is the FCC ensuring that we do have effective communication to emergency services? Can you answer that question?
Yeah, this is Eliot. Thank you, Mark. I think we got a little bit ahead of ourselves here, because I was going to tag on to the last question that you asked Suzy, and then I'll turn it back to Suzy to answer this question, the question that you just asked, Mark, and then I will tag on to that question as well when Suzy is done. But before I do that, I do want to give a couple of shout outs. One is, of course, to the Americans with Disabilities Act, this being an anniversary of the ADA. The important thing to note here is I'm going to talk a little bit about telecommunications relay services, and we owe the whole TDI program to the ADA because it's the Title IV of the ADA where Congress gave the FCC the authority to establish the telecommunications relay program and a mechanism for funding the program. So that is all quite quite important. It's an important part of what we do in the Disability Rights Office. I was going to mention, getting back, and of course, one other shout out I need to give is to Claude Stout for his, for his fantastic leadership of TDI. I'll join the chairwoman in giving that shout out for that fantastic leadership for so many years when he was at the helm of TDI, and Kaika is of course continuing in Claude's tradition there. So now getting back to the question, the one thing the FCC did pretty early on in the pandemic, in fact, it was within days of when the national emergency was established regarding the pandemic. So it was in the middle of March when the FCC started issuing a series of waivers of the rules so that the providers, the TRS providers, could continue to provide service without interruption. And this was quite important because there was, of course, the pandemic and the need for social distancing. And most services were provided through call centers where social distancing would be difficult during the pandemic because of the number of seats and how close the CAs were pre-pandemic in the call centers. So the providers, were willing and able and ready, and did pivot to having their communications assistants working at home. And the FCC facilitated that through a series of different waivers. And that included a number, for VRS, there were a number of restrictions on CAs working at home. And the FCC waived a number of those restrictions so that the CAs could work at home, from the get-go during the pandemic, which not only saved a lot of lives, but a lot, from the CAs, but also allowed the level of service to continue that the consumers were used to and expecting. And of course, the level of service had to increase during the pandemic because with social distancing and people staying at home, that increased the demand for relay services. There was also initially a decrease in the ability to provide the service due to some CAs being unable to work due to childcare and other responsibilities that they had early on in the pandemic. So as a result of that, we waived the speed of answer requirements for the non-VRS services. There was enough flexibility in the speed of answer rules for VRS that we didn't have to waive that, but we did waive it for all the other services, as the chairwoman mentioned. So as I mentioned, we waived a number of restrictions on CAs working at home in VRS services. And another thing is a number of people who were overseas were stranded overseas. They needed to make VRS calls to the US. And so we waived the 4-week limit on being able to make calls from overseas to the VRS for all users who are registered VRS users who are overseas. And we also waived, for those who are already overseas, we waived the requirement to register to call from overseas in advance for those who are already overseas. And that helped a lot with the providers being able to step up and provide the service. And I do want to give a shout out to all the providers who went through extraordinary efforts to make sure that service was provided throughout the pandemic, and that the consumers were able to receive that service. So thank you, providers, for that. Now I'll turn the floor back to Mark, who will ask the question he initially asked me, I suppose. Then Suzy and I will both respond to that.
And this is
Great,
hi,
Suzy.
hi, if I could, sorry, okay, thank you. Thank you. Yes, we can go ahead and rephrase that question that you asked. The first question was about what pandemic measures were taken. And now over to asking a bit more about what kind of options we have to contact 911 and communications in general. It really is a bit more general. What you tend to do is what you should be doing, using voice, text, relay, and so forth. But we do want to emphasize that the FCC is focused specifically on phone companies or carriers like AT&T, Verizon, T-Mobile. We're not focused on 911 call centers or even 988, which is the National Suicide Prevention Lifeline. 911 and 988 are those two that we do not regulate. That is not within our purview. That's under another federal agency. So with that in mind, what do we require specifically for calls to 911? For texting, a lot of people do rely upon texting. We require that if the 911 call center is ready and enabled, the carriers deliver that message to the 911 call center. However, if the 911 call center is not ready, the carrier must send the caller a bounce back message, notifying them that the 911 call center is not able to accept text messages and that they would need to reach out via another method. So it's very difficult to know. We do have a registry on our website where you can go to the Disability Rights Office, which is our office's website at fcc.gov/accessibility. You will see for text to 911, you're able to click on that message on the side, and then you can find out if your state and your area has text to 911 or not. Now, I am excited to share that that registry was just expanded to include RTT, which is real-time text. And I know that some of us don't know what RTT is, but it really is a new TTY. TTY has been around for a very long time. You saw that video at the beginning, which talked about how TDI was established in 1968 and TTY shortly then afterwards. IP networks really do have a modern way of communication. So TTYs are more an analog system, whereas RTT isn't for use over IP networks. So we have already required nationwide carriers to make that available to you all. If you look at your smartphones, if you have AT&T, Verizon, or T-Mobile, it's very likely you already have that there. It's just turning it on. California did pass a law that requires 911 call centers to handle real-time text emergency calls by January of 2021, which has already passed. I'm not sure if it's happened yet or not. However, state and local governments are trying to transition over to make their communication services accessible to you all. In fact, RTT has really saved the day for me. In June, I experienced an emergency and I had to call an ambulance for someone. And I was not at home. I was at a different location. And I used VRS, which failed to reach my local PSAP because I was not at home. The registered address pointed them towards my home location while I was at a different location. So I went ahead and used RTT on my voice line because you're able to use RTT over the voice line just like as if you would with TTY. So I was able to make that call, reach the local PSAP, which is the 911 call center, and they had a TTY there. So I was able to communicate with them about the emergency and the need for an ambulance. They sent an ambulance within a few minutes after that. So please do consider turning on real-time text, RTT, just to know that it is available. It is a way of communication where you can communicate directly with PSAPs. all is well now with that emergency, but I thought it was good to share that story to show an example of sometimes we need to be ready with different options to communicate with 911. Given that we are deaf, we can't reach them directly with a voice, for instance. One more thing I wanted to share about emergency. We do have a recent rulemaking in place about the nationwide suicide prevention lifeline. It does direct that there must be a 3-digit number to make it easy for people to remember. It is 988. Starting July of 2022, it will be that number. Consumer groups, including TDI, are, of course, interested in deaf people. Deaf people would not be able to call 988 directly. They wanted to see if it was possible to have text directly. So we did release a further notice of proposed rulemaking, which will close on August 10th about that proceeding. We do invite your comments. Do you think that text to 988 is valuable? Should it include real-time text? And when should it start? So thank you to some of you who have already submitted comments. We do welcome further comments. It is in the docket number 18-336. I will type that in the chat as well. But you can also reach out directly to us at dro@fcc.gov. We're happy to help provide that information. We also have an ASL phone line as well. I would like to now invite Eliot to come back and provide some more comments about how to reach 911 through relay services. Thank you, Eliot.
Okay, thank you, Suzy. Basically relay services are required. They're all required to deliver the 911 call to the local public safety answering point, which we call the PSAP. Now the analog services, for the analog services, that is all delivered through the underlying telecommunications service provider. Then for the, however, for the, and that would be for the TTY-based services, speech to speech and analog caption telephone services. But for the, now, and with internet protocol caption telephone service, if the user is, for most forms of internet protocol caption telephone service, the user is already a subscriber to a telephone or voice over internet service, and that provider is responsible for delivering the call to the appropriate PSAP. But with some forms of internet protocols caption telephone service, IPCTS, where the IPCTS provider is also serving as the VoIP provider, as well as for video relay service and IP relay service. At this time, the providers are supposed to provide the service, provide the service to, as Suzy mentioned with her emergency, to the registered location. That's the location that you give the relay provider when you register for service, and that becomes the registered location. However, the commission adopted a change to that requirement, which and those rules become effective not too long from now, less than half a year from now, on January 6th, 2022. And so that's when the providers have to comply with that rule. And at that point, the requirement shifts from registered location to dispatchable location if it's technically feasible, and only use the registered location if the provider, if it's not technically feasible for the provider to find the dispatchable location. But basically, the dispatchable location is supposed to be where the person actually is at the moment they're making the call. So in Suzy's situation, because she was not even in her home state when this emergency happened, the call went to her local registered PSAP and not to the PSAP where she actually was making the call on her. And so this would, and so for example, the provider can very often, if you're on a mobile phone, or smartphone, can take advantage, or any mobile phone can take advantage of the location services on that smartphone. So if you get the message when you're making a 911 call and you are not making it under the native telephone part of the provider, will ask you if you want to turn on location services. Be sure to turn them on. And even better yet, if you're about to make an emergency call, make sure your location on a mobile phone, make sure your location services are turned on. They automatically turn on if you're using the native phone function. There's the phone number that comes with the phone, but most relay services are over the top and therefore are not using the native phone function. And that's why location services need to be turned on when making that 911 call. And the same thing, if you're using a tablet or a laptop or other computer, there are ways to locate somebody through internet information, network information when you're using the internet. So that's how you get located with dispatchable locations. So it's if that's technically feasible for the provider. And so basically, so hopefully this will solve the kind of problem that Suzy faced. And fortunately, Suzy thought quickly and figured out a workaround, another way to get to 911 that would work for her. So hopefully starting January 6th or sooner, if the providers implement dispatchable locations sooner, that problem hopefully will not reoccur. In terms of 988, providers are required to deliver 988 under the rules are required to deliver 988 calls for those emergencies to the 988 center. And of course, that's not location specific. They go to call centers that basically act as the first line of assistance during a mental health emergency. And so that's what 988 is for. And then, and very often they, it's part of that first line service. The 988 center may then assist somebody in finding a local service that they might need subsequently, or maybe immediately, that they can help that person connect with. So anyway, thank you. And I'll now turn the floor back to Mark.
Thank you very much, both Suzy and Eliot, for your answers in regards to emergency access. So it's really valuable information for our audience today to learn what the FCC is doing in that area. And now I'd like to shift to Will. He is responsible for filing complaints at the FCC or collecting information if consumers want more information about specific issues. Will, can you elaborate on your role? And then to follow that with answering this specific question. How does a consumer file comments and seek assistance from the FCC?
Absolutely. Yeah, thanks very much. Like you said, my name is Will. I'm overseeing the complaints that come into the FCC regarding disability-related issues. And there's really, I just want to cover just what you asked for, Mark. I wanted to cover kind of how to file a complaint and then also how you can get information. So maybe maybe the issue that you're experiencing is not quite complaint ready, but you just want to find out more information. We can help with all of those things. So let's start with complaints. So first of all, the Disability Rights Office has two types of complaints that can be filed. One type of complaint is a kind of a standard complaint. This would include issues like closed captioning or relay services. And all of the issues that Suzy and Eliot and Diane have been talking about, they can all be filed with us if you have a complaint regarding disability, and we can take it from there and help kind of process information. But the standard complaint, when we get these, we will send that information to the covered entity, and then the covered entity has to respond within 30 days. It's important that when filing a complaint that you provide as much details as you can. In fact, there's rules that require a minimum amount of information. So let me give you an example. Sometimes we get complaints that say, captions are bad on TV tonight. Well, we actually need to have specific information in order to send the complaint to the right covered entity, and to give them an opportunity to figure out what's wrong and how to fix it. So at a minimum, we need to know like what station you're watching, what program you're watching, what time you're watching, and what exactly is going on with the captions. You know, are they garbled, or are they missing, or are they falling off the side of the screen? And then also we need to know whether you're watching on the internet, like on an app or something, or whether you're watching over the air broadcasts, or whether you're watching on cable services. So however you file these complaints, we may ask some follow-up questions, because just to make sure that we can send this to the right entity. Now, the second type of complaint that we can receive is regarding telephones and telephone services. And this type of complaint is very interesting. It's called a request for dispute assistance, or we abbreviate that to RDA. So if you file this type of complaint, the FCC will assist in the communication between you and the covered entity. And we will do this for 30 days and try to come up and work with the two parties to try to find a satisfactory resolution that's satisfactory between you and the covered entity. Now, if a resolution cannot be reached between the two groups, then you would have an opportunity to file a complaint with the Enforcement Bureau, and they in turn would have they would have to make a determination about if a violation has occurred. Now, we have a very high track record of helping the two parties come to a resolution. So it's been a very positive complaint process. So anyone can file a complaint by going to fcc.gov/complaints. And you can also call or email us, and we can help you file a complaint. So if you call or email us, we can either provide you with information, like if you just have a question about a rule, we can provide you that information. Or if you want help filing a complaint, we can help you do that as well. We have an ASL customer support line. So it launched in June of 2014, and it allows deaf and hard of hearing consumers to engage in a direct interactive video call with a consumer specialist at the FCC who can provide assistance in ASL. And that person can also help file a complaint or give you information. So if you want to call the ASL line directly, you can call it at 844-432-2275. And the hours of operations are between 9:30 a.m. and 5 p.m., Monday through Fridays. Regarding access to information, we have a lot of information on our website, and we try to keep the website up to date, even up to the moment. And our website, where you can look through all of these topics that Suzy, Eliot, and Diane has been talking about, each one has their own link, is fcc.gov/accessibility. And in each one of those categories are consumer guides that will summarize the various rules for each of those topics. There's also links to the actual rules themselves if you want to read the actual rules. And then there's also information near the bottom on most of those pages called headlines, which is the most recent activity that's happened on that particular topic. I want to mention a few other interesting resources that you may want to look at. So that would be every 2 years, we have to file a report to Congress explaining what has happened in the last 2 years regarding communication services under the CVAA. And the last time we filed this, we sent this report to Congress was on October 7th of 2020. And that report lays out the progress that we made in accessible communication as a country. And this report to Congress it also includes the types of complaints that we received and how those complaints were resolved. And it's a pretty interesting read. I'll once I'm done speaking, I have a link to that report to Congress, and I'll put it in the chat. But it's always available at our website, which is fcc.gov/accessibility. And just for reiterating, if you would like to just email us and ask for a copy of this or ask us any questions, you can email us at dro@fcc.gov, or you can call us, and we will be happy to provide you all sorts of information. So one more thing, and then I'll pass it back to Mark. And that's, if you want to stay up to date on the FCC's activities, you can sign up for our listserv. We send out emails on things that are happening at the FCC regarding accessibility. And you can send an email to asking to subscribe to the email address accessinfo@fcc.gov. There it is. Thank you, Mark, for posting all of that in the chat. And with that, I invite everybody to file complaints if you see something that you believe is violating our rules, and to feel free to reach out to us at any time to ask questions about FCC rules and issues.
This is Mark. Thank you so much, Will. Really, I appreciate everyone's contribution this afternoon on our conversation with the FCC. Diane, Suzy, Eliot, and Will, this is such great information and very valuable. I really appreciate your contributions today. And I see that many questions have floated through the chat from the audience. And individuals do have answers online for them. And I would like to also say thank you to all of our sponsors for making this panel possible today. I look forward to joining all of you at the next fireside chat. And then the closing meeting this afternoon, which is the President's reception at TDI and the awards ceremony. And I'm hoping that you all enjoy the rest of your conference today and throughout the week. And that we all reset and reconnect. If you would please, all of the FCC individuals, our panelists today, would you please turn on your video so we can see you again? I thank you so much. A big hand wave and applaud to you. So thank you so much for your contribution to accessibility for individuals in America. It wouldn't happen without each of you. Thank you so much.
Thank you.
Enjoy your afternoon.